Dr. Joseph Ladapo, MD, PhD, who I'm actually a huge fan of, because he enjoys making fun of the CDC and is pointing out their crap. Unfortunately, he sent this newsletter out to every clinician in the state of Florida about the cholesterol hypothesis and perpetuating the myth that cholesterol causes heart disease. I was actually quite disappointed to hear this from him because he seems to be so well versed in everything that's wrong with our mainstream. One of the biggest problems with our mainstream is the cholesterol hypothesis, and the recent literature is not supporting this anymore. The British Medical Journal is onto it, indicating that elderly people with higher LDL-C live longer than people with low LDL-C. Increasingly, European guidelines are changing, indicating that targeting only LDL-C could result in a lot of missed opportunities for cardiovascular risk reduction. This here is quite striking. Total cholesterol levels when lower is increased with higher risk of suicidality, including 123% higher risk of suicide attempt and 85% higher risk of suicide completion. So just looking at that, we have to step back a bit and think, whoa, why are we focusing on lowering cholesterol here? Is that really a good thing? Are there potentially downstream consequences of this? Oh, but that's just mental health, you say. Heart attacks are way worse. Let's look at some of the data. The Get With The Guidelines study database looked at almost 300,000 patients in hospitals all across the US. They found that patients admitted with acute coronary syndrome, meaning a heart attack or having a stroke, had LDL cholesterol levels in the normal range. The number needed to treat with statin drugs to prevent one heart attack is 104, and to prevent a stroke is 154. That means you need to treat that many patients to prevent one of those problems. However, the number needed to harm is much lower, so you only need to treat 50 patients for them to develop diabetes, and only 10 need to be treated with a statin drug to have muscle damage. But looking back on the data of this whole paradigm that we've been focusing on for the past 70 years in medicine of lowering cholesterol, we're finding that it actually increases mortality rather than preventing it. I urge Dr. Ladapo and others who are perpetuating the myth of the cholesterol hypothesis to look into the new biomarkers we have at identifying those who have risk factors for cardiac disease. We have the NMR lipoprotein fractionation, we have homocysteine, we have lipoprotein little a. If you'd like to hear more on these topics, let me know. There's a lot out there that no one's talking about that we can use to identify risk for cardiac disease and treat it. But treating cholesterol and focusing on cholesterol is not the answer, not in the year 2023.